Hello, we're going to talk about treatment of psychological disorders today. We'll talk about the different perspectives of psychology, how they approach treatment, and what specific treatments are best for different types of disorders. Buckle up. Let's get into it. Here we go. So we'll start with types of treatment. Treatments are going to vary based on the specific mental condition, as well as what's the most appropriate approach. We'll get into all those different ones here in just a sec. Modern treatments include a couple key features. They are correcting damaging thought patterns, number one. Number two, helping clients learn how to cope with different conditions and symptoms, and then also teaching healthy ways to respond to difficult situations. A few of the general therapeutic models include biomedical, we'll talk about at the very end, using chemical drugs, eclectic, a combination of techniques, and most therapies use some sort of combination approach. And then also talk therapy, also called psychotherapy, helping individuals, groups, families change those different behaviors and thought patterns. All right, so starting off with psychoanalytic. Who was this? This was Freud. Remember, psychodynamic are neo-Freudians. They came after Freud. Psychoanalytic is Freud. Going back to Freud, he believed everything was unconscious. Everything was like aggression and sex and unconscious forces. His core was about the id, the ego, and the superego. So if you remember, the id is kind of like the devil, the impulsive side over here on your shoulder. The superego is like the angel, like the moral side over here. And your ego is kind of your brain trying to balance the two. You can see the pyramid right back here. There it is. All right. His three main techniques to access the unconscious were free association. So if I said a word and then you said the first thing that popped in your head, that's kind of tapping into your unconscious. Also hypnosis. So finding those repressed feelings and thoughts that normally don't come out, but under hypnosis, they might. And then the third one is dream analysis. So patients describing their dreams and then the therapist interpreting those dreams. Two things to remember with dreams. Manifest content refers to like the actual idea of the dream, what the dream was about. Whereas latent content is the meaning behind those. So if I had a dream about cats, the meaning might be that I'm obsessed with cats. I'm a little obsessed with cats. I love cats. They're the best. Now, the hard thing with this is it totally relies on the therapists and their interpretations. So it's very subjective. There's not a lot of science-based evidence for this type of therapy. A couple things to go with this: resistance. A therapist might be like, hey, you're resisting this therapy because the repressed or the unconscious ideas are just too painful. And then one of the techniques is transference. So like if I'm angry with my dad, I can transfer that anger onto my therapist and kind of work through some of those emotions. This is best used with patients having a history of unresolved trauma. But again, there's not a lot of empirical support for it, so it's not really used too much today. Humanistic is the next one. So remember Abraham Maslow and Carl Rogers, they focus on helping people understand and accept themselves while trying to get their highest potential. So if you remember Maslow's hierarchy of needs, the very tippy top up there was self-actualization. So trying to get people up to that self-actualization level. Carl Rogers, he pioneered client-centered talk therapy. So there's a couple of aspects that go along with talk therapy. So one, it helps patients grow in self-awareness and self-acceptance. He focused on patients achieving that self-actualization we were talking about, promoting active listening with genuine empathy. So a couple aspects of active listening: you listen, you try and restate what the other person was saying, and look to clarify some of their ideas and their statements. He wanted to provide unconditional positive regard. This was paramount to Rogers and his theories. Unconditional positive regard, it's blanket overall acceptance and support no matter what the client says. And also it's non-directive. So it's not me saying, hey, you need to do this, this, and this. It's like, hey, what do you think you could do about this? Letting the client actually choose that course of action. This is used really well for anxiety, for mood disorders, and personality disorders. All right, next up, we have behavioral therapy. This is awesome. I think these are really interesting. Believing all behavior is learned through modeling and conditioning. So remember, operant conditioning, classical conditioning. These therapies use a lot of those same principles. So let's go through a few of them. So we got counter conditioning. This is classical conditioning. So remember Pavlov and his dog salivating every time they saw Pavlov because they were going to get some food. Same idea here. Classical conditioning, where an unpleasant response is replaced by a pleasant one. This is Mary Cover-Jones. She came up with this idea. But if a kid is scared of going to the dentist every time, before they go to the dentist, maybe they get a treat and then they go to the dentist. And over time, pairing that like good treat with the scary dentist, eventually when they start going to the dentist, they'll be thinking about the good treat and get those positive emotions. So that's counter conditioning, trying to flip those conditioning. Systematic desensitization, this is replacing anxiety with a relaxation process and getting more and more comfortable with your fear step by step. Let me give you an example. So patients are going to begin with low anxiety activities, use relaxation techniques, calm down, and then gradually work up to a little bit more anxiety actions, a little bit more, and eventually they can face their fears. So for example, over here I have the lowest anxiety on the bottom. Thinking if you're scared of spiders, thinking about a spider, anxiety, calm yourself down. Eventually be okay with thinking about spiders. Then step up to like looking at a photo of a spider, looking at a real spider, touching one with a glove, maybe touching one with no glove. Gross. I don't like spiders. But that would be a good process for me to go through. So systematic desensitization, step by step. Similar to this is flooding, but it doesn't do the steps. It just goes straight to the last scariest one first. So just facing your fears head on. Sounds awful, but maybe it works great. I don't know. There's also virtual reality exposure. So if it's too intense of a fear, maybe like the fear of heights, you wouldn't experience actual heights, but you would put on like virtual reality goggles and experience it through that process and systematically desensitize as well. Aversive conditioning, unpleasant conditioning for an addiction. So stopping a behavior through this conditioning. So you pair an unwanted habit with a negative consequence. We talked about this before. Sheep farmers actually use this with coyotes, and they would put on their sheeps a poison that wouldn't kill the coyotes, but it would make them super sick. So if a coyote attacked and killed a sheep, they would get violently ill, and then they wouldn't attack other sheep because they were aversively conditioned not to attack those sheep. This is like the Garcia effect. We've talked about this before. Taste aversion. So having a strong aversion if something causes you to be nauseous. So if you get food poisoning sometime, you maybe not want to go back to that same restaurant. I have Taco Bell up there because I got food poisoning once, but I love Taco Bell. I got over it. I go back. And then there's also the token economy. This is when desired behaviors are rewarded with tokens, and those tokens can be exchanged for other privileges. So this could be like with little kids and like a star chart. Every time they clean up their room, they get a star. That's a token economy. Once they get their chart filled up, they get a prize or something like that. This is best used with abnormal behavior patterns, maybe like phobias or different anxiety-causing behaviors. Cognitive therapy, so this is the way that we think. Abnormal behavior, the result of unhealthy thought patterns. This therapy, rational emotive behavior therapy, this exposes and confronts those dysfunctional thought patterns. This is Albert Ellis, and he used the ABCs. So he discussed with clients their actions, the beliefs about those actions, and the consequences of those beliefs. So if you look at the little chart over there, thoughts create feelings. Those feelings then create behaviors, and those behaviors then reinforce those thoughts. So it's this cycle that you get into, and you want to stop those irrational beliefs and stop that cycle. This is best used with people who cannot rationally problem solve. Here, check out this quick little video clip.
Cognitive therapy focuses more on what people think rather than what they do, assuming that if you can change a self-defeating thought, you can change the related behavior. This is the approach used by founding American cognitive therapist Aaron Beck. He and his colleagues pioneered the Socratic questioning method to help clients reverse destructive and catastrophic beliefs about themselves, the world, or the future at large, such as everything that could possibly go wrong will go wrong. Say Bernice has a big test coming up, like a really big all-or-nothing end-of-the-year exam. She's freaking out, and her anxiety around the test already has her depressed, imagining that she'll fail. If she bombs the test, she fears that her dreams of getting into the graduate program she wants will be dashed and her life will be over. Classic catastrophic thinking. A cognitive therapist would actively discuss all of this with her, challenging her thinking along the way, and in the end, help Bernice re-examine her assumptions about what's going to happen if she does fail. Like, the world will not end and she will not utterly fail at life, helping her work toward thinking more positive thoughts about herself and her future. The cognitive therapist helps patients understand that changing what we say to ourselves is a very effective way to cope with our anxieties and modify our behavior. In other words, it really is the thought that counts.
All right, good stuff. Last slide here, we got the medical model. This is biological. This is focusing on our brains, our brain structure, chemicals in the brain, hormones, even our genetic predispositions. The first one up here is electroconvulsive therapy. This is used with severe depression. So if other types of therapy are not working with depression, this is actually a pretty good option. It is a brief, it sounds crazy, but it's a brief electrical current through the brain while a patient is under general anesthetic, and it's super effective, like 80% effective. So it disrupts some of the memory, some of the thought process with that, but it's very effective. Psychopharmacology, this is using psychotropic drugs for treatment. Let me give you a couple examples. So we have tranquilizers. Those are anti-anxiety drugs. They slow down the nervous system. They reduce anxiety. Zoom. All right. These can become addicting, lead to other issues like tolerance and withdrawal symptoms. So some tough side effects. Antipsychotic drugs, these decrease agitated behavior, maybe hallucinations. They block dopamine receptors in the brain, but they can have serious side effects. So if you think back to schizophrenia, there's the dopamine hypothesis. There's too much dopamine. This reduces that and also reduces some of those symptoms as well. Mood stabilizers, things like lithium or Prozac, they can regulate bipolar disorder. They kind of just even things out so you don't get the high highs or the low lows. It's just more steady across the board. And then finally, antidepressants, these elevate the mood by elevating serotonin, norepinephrine, and dopamine. Exercise does this as well, but that's kind of how antidepressants work. All right, guys, we did it. We're done. That was fast. That was quick. 3 quick questions here. Let's do this. The analysis of a client's past experiences and suggestions for the ways that client can overcome his or her problems that stem from these experiences is the basis of which type of therapy? Cognitive therapy, behavioral therapy, developmental therapy, psychoanalytic therapy, or social cognitive therapy? Think about it, make a choice. The answer is D, psychoanalytic. 4 decorations. Look at all those great decorations. I love birthday parties. Ooh, next one. Ooh, you got to look at the picture though. Let me move. Okay. Aversive therapy refers to using generalization to let all negative behavior pairings occur. A classically conditioned therapy based on the theory that repeated pairings of negative effects will then lead to extinction. Spontaneous recovery occurring after a behavior that was based on negative pairing has ended. An operant conditioning therapy that uses negative reinforcements to continued behavior, or the use of modeling behavior so clients can see the consequences of negative behaviors. Look at that country up there. Can you tell? Maybe by the flag? I don't know. It's B for Botswana. It's classically conditioned therapy leading to extinction. Good. Last one. Here we go. Last one. Joy's therapist is trying to encourage her to take charge of the therapy session. The therapist uses active listening while Joy discusses her feelings. Which therapy is most likely being described? Psychodynamic, rational emotive therapy, existential therapy, cognitive behavioral therapy, or client-centered therapy? You know, it is E for education. Client-centered therapy. Nice. Give me a quick 1-sentence, 20-word summary of these notes. It's going to ingrain it in your brain. It'll be so good for you. Do it. All right. That's all I got for you. Well done. Get ready for your test. Here we go. Enjoy the day, my friends. It's Friday here. Happy Friday. All right.